Trigger warning. The following content may discuss sensitive topics such as mental health, abuse, violence. Please proceed with caution and take care of yourself. If you feel uncomfortable, it's okay to step away.
Hi Nell, hope you're okay. Sorry. I'm very tired myself. Hey Lorna darling, how are you? Hey Kate, hi Lynn. How are you doing, Kate? Hope you're alright. Can't sleep yet, so it's bloody annoying really, but you did you? That's good, lovely. It's lagging a bit, is it? Or is it just me? Because I am really like, I don't know, I'm a bit funny right now. I'm really, really drowsy, babe. So yeah, it might be just me or it might be your phone, I don't know. You're cold, are you? It's not, okay. I am very tired. I had a seizure this afternoon, sweet, so unfortunately I'm knackered. I'll be alright. It's alright. Thank you guys. Yeah, I'll be alright. Just the seizure has wiped me. I had a sleep after, it's just not enough. Fix itself, okay. Thank you. Hey Tanya, how are you? Am I on my own? Yes, I live on my own, sweet. But I've already had it, so it's fine. It was hours ago. I'm just exhausted. Babe, it was hours ago. I'll be fine, don't worry. Like, I've got my care alarm if I need to press it. So they have to come and be here while I'm having it, babe. So someone is always here with most of my seizures because my oxygen, etc. drops. So it has to be monitored in case of needing an ambulance, etc. and needing rescue meds. Because I have epileptic but also non-epileptic seizures. So yeah. But they're mostly at night. Not during the day, but for some reason, because I've got an infection, we think, well, I know I've got an infection, which normally triggers more seizures for me with my epilepsy, so yeah. Yeah, they do, darling, they do. But mine is epilepsy and also non-epileptic attack disorder, so I have both different types. Today's was an epileptic one, which is why I'm especially drowsy. But yeah, it's okay. I'm just drowsy, Abby. I'm okay, like, I'm not falling asleep. Yes, I am. I've just taken my dose of them for this evening. But here, I need to put them on the fridge, back in the fridge. Thank you. Hi Keely, lovely, how are you? Hi Sel. Hey Els, how are you doing? Sorry, but I'm just checking who's in here. Hi Kaylee, how are you? Gracie, are you okay, sweet? Sorry. Evening, Katie, darling. How are you, my love? Yeah, I'm okay, my lovely, thank you. I'll be fine. It's just, yeah, literally knackered. Absolutely knackered. But I will be fine. It's alright. No worries, Lottie, at all, darling. Hi, Victoria. Hi, Donna. How are you guys? Hi, Lou. Huh? Get you okay? Well, I'm confused. Oh, yeah, you okay? Yeah, I'm alright. How are you, sweet? You're just new here. Hi, Leanne. I hope you're okay. God bless you, darling. Katie, that's lovely to do. Yeah, I'm alright, sweet. Tired, but I'm alright. Victoria. Alright, lovely. How are you doing? Hope you're well. Oh, bless. Bless you. Alright, yeah. Oh, bless you, Lou. Honestly, I've got pressure sore, like, right on my coccyx at the moment. So I'm sitting in weird positions too, like, trying to, yeah. Pressure sores are not the one. Especially because I can't literally lay on my side or anything. I have no choice but to just put something under me and like prop myself off of it. Which is what I'm doing, so I'm kind of sitting a bit skew-whiff. I mean, I have like a barrier cream and an ointment prescribed, but it's a nightmare. Absolute nightmare. Sterilizer. One sec. Sterilizer. Diprobase, oh, I've not heard of that. Like, I've heard of, like, Diprobase or, not Diprobase, but something else, something base, used for, like, eczema and stuff, but not for bed sores, babe, or pressure sores. No worries, darling. See, I've got Mediderma, which is a barrier cream, so it's different. Barrier creams and a barrier ointment. So yeah. Which is especially for, you know, pressure sores. Hey, Ollie, darling. But what I need to do, I keep forgetting to order my catheter supplies. Double base, yeah, they're for eczema normally, aren't they? I can't use the Manuka honey, babe. I know which one you mean. I'm not going off, babe. Oh yeah, off the other one. I've come back on, just on a bigger live, babe. Just on follower only. Sorry, yeah. I'm still on, babe, though. It's follower only instead of friends only, so it's just a bit bigger. Just so more people can come in. Yeah, no, like, because they have one called, what's it called, Medi Honey, but that one reacts with my skin, makes it really just, yeah, horrible. But yeah, I've got them ones up there. So the Mediderma cream and the Mediderma ointment, which they are really good, to be fair. The ointment is a bit like super glue, like the consistency is a bit like glue though. Okay, darling, no worries. It's alright, my love. Grateful to have you here while you were here, babe, so thank you. Is she? Yeah, I've been tube fed pretty much my whole life. Not completely continuously, but most of it, lovely. Yeah. Yeah, they use different ones in different areas, don't they? But yeah, tubes for different reasons, but long time as well, which is a nightmare. But I had a surgical tube, so you didn't, like, most people wouldn't have known I had a tube. Yeah, I get you. So that's exactly what I would do as well if I could go out, babe. So they give a backpack and they give a stand, and you put this pump in the stand, and yeah, I get you. That's what I used to do. So I used to have a tube that went through my abdomen, so you couldn't tell I had a tube, basically, but obviously it wasn't on my face, but it caused a lot of issues. Okay, darling. I don't know which one you mean. Oh yeah, I know which one you mean, I can see. Thank you, darling. Gone. How have I been? Katie? Yeah, I'm alright, thank you. How are you? I had a seizure later, but this afternoon in my abdomen, so yeah, the hole closes up, babe. So I had a peg J, it went into my stomach, and like, so they make an incision, and it was a tube that went into my stomach and into my intestines. Thank you, darling. Funny how I've just got a load of friend requests. Yeah, bless her. I had it for 5 years, well, about 5 years roughly, babe. But yeah, didn't work out long term for me, babe. Normally, like, if you require tubes, like, long term, like I do, they would have kept it in, but I couldn't because of complications. So I had it 5 years and then had it taken out, basically. / it partly rejected, so had to have it taken out. But yeah. Oh, bless her heart. That's awful. Bless her. But it was a peg J, so the J portion, which is like the NJ, but going through the abdomen, used to flip back into my intestines a lot, which was a nightmare, and it took a lot longer to get it sorted as well, because only certain people could sort them. Hi Abby, you're back. Welcome back. Well, one of the types I had, like one of the brands of tube I had, used to break as well. So the actual extension that went into the jejunum used to actually pull off of the tube, and it used to break off, and then it'd pull out of the tube and leak out, which wasn't good. So yeah, that was not good at all. My old feeding tube actually, babe, but yeah, a bit random. No, it wasn't good, but they commonly do that. Actually, they break. They have a clamp on, so you can clamp it, but then it means obviously it was unusable. How did they get it out? No, it literally pulled out completely, babe. So the jejunal extension literally pulled completely out. Yeah, so I don't go to A&E for my tube now. I go straight to the gastro department, which I'm very lucky about. So it was like this really long extension, but the whole connection of it would break, if that meant that you wouldn't necessarily know what I mean unless you've seen it or experienced it yourself. Like, it's hard to describe, but yeah. It had two ports to the tube. One of them would be the extension going through it, and then it would pull out, basically. No, it's to the gastro ward, not Estec, darling. So it's open access to the gastro department. How often? I can't change my tubes, darling. This goes into my intestines. So I can change my NG. My NJ has to be done in hospital. So yeah, it's whenever it needs it, really. Yeah. Oh, okay, yeah. So I don't have diabetes, darling. I just have hypoglycemia. Yeah. My hypoglycemia is not great, but obviously it's not diabetes, and I'm grateful it's not. Like, not being funny, but it would be worse. It would be worse to be diabetes, is what I mean, and I'm grateful I don't have that, and I'm sorry for the people that do, because it sounds awful. I know some people get good management over it, but I know a lot of people that also don't, and like fight constantly. Is she, darling? Bless you. Does she? That's good. It's hard being tube fed as well with blood sugar issues. Any sort of blood sugar issues, and being tube fed is so difficult. Hey Charlene, how are you? And yeah, I'm okay, thank you. Like, I really struggle with my blood sugars. I'm actually going to just check where they are now. Just check quickly. I use a Dexcom G7, so yeah. See, this is what mine have been like in the past. Well, that's 24 hours. So like, they're 4.9 now. But look how, like, up, down, up, down, up, down, up, down. Like, but they're, like, all the low points have been so, like, ugh. And they're not how low they go. I go into the 2s and 1s sometimes, which is obviously really low. But it's crazy just how they go down so, well, so suddenly and quickly, unfortunately. I've had a lot of bad hypos, especially recently, but it's one of those things. I just remember to put that back in the fridge. 1.2. that's while being conscious, but actually the other day, hang on, I can actually show you this from the other day. It's on my monitor. Bear in mind, this is a new monitor. It has the time on it and it has the date on it. I think it was on the 10th of April. And it's absolutely crazy, but it was in the ones, which is like stupidly low anyway. Yeah, no, I was actually sitting on TikTok live, and I cannot believe I'm actually even saying that, because literally what I was sitting on here. I was a little bit out of it, but I didn't realise I was. What number is it? So that's the 13th. 12th. It's in the memory, 11th. So it was on the 10th of April. It's a really low one. So that's 6. 2.6 I had. Hang on, let me turn it around, it's easier. So that was at 8 o'clock on the 10th of April. That was 4.4 on the 10th of April. That was 5. But yeah, 3.8. I had a lot of hypos at it. 1.2 was it? 10th of April, 3:43 a.m. 1.2. How crazy. Like, that was... And I was sitting on here. And that is what blew my mind. I mean, I weren't very well. I passed out. But yeah. Like, I was fine until, yeah, then I just passed out. But I said I was fine. I don't know if I was fine. I obviously wasn't fine because I passed out. But anyway. I am lucky, darling, yeah. Yeah, it weren't great, babe. It weren't great at all. I can't really remember it. I just remember taking it, but... I think in the end, I ended up having 3 glucose shots, and it ended up bringing it up to like 4-ish, which is obviously a good level or a safe level. But I had 3 of these, which one of these is 15 grams of fast acting glucose. So I had like 3 of these pushed slowly through my tube, and I also had an IM glucagon from the paramedics, I believe. Although I'm not entirely sure. Because I was passed out, so like, that's from what I was told, like not actually knowing fully. Yeah, exactly, the injection, the glucagon. But I can't have too many glucagons because they rely on fat reserves in your body to change fat into sugar. And I do not have the fat stores in my body to change to sugar, to convert back to sugar, you know what I mean, like to break down into sugar. So that's the problem because of my malnourishment, long-term malnourishment, which is, yeah. So that's why, unfortunately, they can't give them too often. I say unfortunately, they try and avoid them at all costs, but also IV access is really, really hard for me to get on me, like for them to get for me. So normally they need vascular access team. So if they're not available and with ultrasound, they just have to do the quickest thing, but sometimes it makes them drop further. Yeah. Yes, that's what I mean, yeah. Precisely, darling. Have you not? Wow. That's actually quite good. See, I'm not diabetic, but I need a glucagon probably... Well, I've had 3 or 4 this year. Although one of them didn't work at all and needed loads of IV glucose. But yeah. I think I've had 3 or 4. I think 3, but maybe 4, I'm not sure. And then we're only in April, so Jesus. And I'm not even diabetic, which is just, ugh. Well, we are in April, we're nearly in May, but you know what I mean. Not even in April, Jesus, I forget which month we're in. Hi Wendy, hi Senna, lovely. Hey Lauren, how are you guys doing? Hope you're okay. How are you guys doing? Hope you're okay. Yeah. Yeah, so do I, darling. So as soon as I hit 3.8, I normally give one of them. What do my feeds look like? That's my feed in the bag, darling, but yeah. Thank you. Yeah, I normally do too. That's why I'm just, like, so I have to treat straight away, but I'm a bit apprehensive about treating straight away because I just, yeah. Well, I don't like treating basically, so I try and avoid. But then when I get to 3.8, I'm like, no, because I'm going to drop so fast. So then I do just treat regardless. Those look like brown stuff. I don't know why it's brown, lovely. Although there's loads of different feeds, so it's just, yeah. No, it doesn't, unfortunately. All feed is different. Yeah, I know, babe, I know. That's what I was going to say. I've just personally never seen a brown one. Although some of it is like, you get ones that like smell a bit fishy. There's like a Pepjasorb HEHP by Nutricia, and that is like fishy smelling. Really bad. Like, it smells like fish. I've been on nearly every feed possible, which is really annoying, but, well, I have actually been on every feed possible, and yeah. Has fish oil in it, lovely. So it does smell fishy because there is fish oil in it, which I find disgusting, but yeah. The packaging smells funny. Do you think? What company are you with, lovely, though? Like, who is your delivery company? Do you mind me asking? Are you tube fed, love? Or is it drinks? Hot plastic. Oh. It depends on what company you're with, like which area you're covered by, but also what you tolerate and what your needs are. So how many calories, how much protein, etc. your body needs, and also what condition you have, etc. It's normally the protein and the calorie content they focus on most, as well as the micro and macronutrients. And if you can have fibre or not, whereas I can't have fibre, I need a lot of protein and need a lot of calories. But at the moment we're working on building up because I'm not getting what I need, so yeah. And it also depends on how like active you are and how much. You bought some? Why did you buy some, darling? You can get it on prescription, my love. If you need it. Oh no, you're on about collagen. I'm on about collagen, which is a feed, like, supplement. Sorry. Wrong thing there. collagen you're on about for like a supplement, whereas I'm on about collagen, which is like calories and emulsive, like basically fat. Hey Elisa, you get dizzy tape. Yes, some people make it, some people don't, lovely. You can get it from some places. The tapes I get, the pretty tapes I buy. So some you can buy different ones from different people. Like different people do different ones, therefore I buy from multiple places. Like tape wise. Multiple tape designers, because they have to be licensed. Caremark. Oh, okay, I've not heard of them. Yeah, I'm Nutritia too. That's my pain patch, darling. Hi Amy, darling, how are you, sweetheart? So this is a patch they use to treat chronic pain that absorbs through the skin, so it's a transdermal absorption pain patch. So it absorbs transdermally instead of through any of the GI tract, etc., like normal medication. It is clever, and it's good for someone that has like digestive conditions, etc., or like gastro conditions. But yeah, because obviously it doesn't go into my GI tract at all, it absorbs through my skin, which is very different. It's not super effective, but it helps a little bit. Oh, bless you, darling. Yeah, I get bad back pain. It's not necessarily nerve pain. I get shoulder pain, like shoulder pain. Nerve pain in my shoulders, sorry. But yeah, back pain, so I can feel you on that one. It's horrible though, lovely. I hate having to take painkillers, but I'm on them regularly because it's better to keep it under control than to let it get on top of you, unfortunately. And that is what the pain nurses even say to you, like when you live with chronic pain. They say it's better to keep it under control. Do they? Oh, okay. Yeah, see, physio for me is a hard one. Like, only because of my EDS. So I need strengthening exercises. Lidocaine. Oh, yeah, no, they don't work for me. Lidocaine is like a local anaesthetic. Like, it doesn't do anything with EDS. Or rarely does. For me, it personally doesn't. A lot of people with EDS don't. They change, darling. My eyes change colour. They change from green, blue and grey, which is quite crazy actually, but yeah, they actually do. Yeah, I'm on Progab, Morph, Code, Een, and buprenorphine, which is the patch. So the patch is buprenorphine at 15 micrograms an hour. Well, actually it's 20 micrograms an hour, but this is 15, and then I have a 5 on my back as well. Because they can't find the 20 milligram patches at the moment. 20 microgram patches has recently been increased. So they just added an extra one in, which is a 5. But before that, I was on Oxy Norm liquid. So because of the Oxynorm liquid, when I was in hospital, when I first became paralysed, that's why they tried to put me on a pain patch that could match the Oxynorm, so I didn't have to come home on Oxynorm. Because I didn't want to. And they don't like giving that either. So no, it doesn't, darling. Zoxy, or Oxy, yeah, that's what I'm on about, lovely, the liquid Oxy. I don't like it though. I was on that in hospital and that's what they put me on for months and months. But that is what I was on. That's why they changed me to the patch, to try and get the patch in my system and working before I came home, so I could have the patch instead of having the oxycodone at home. So I didn't want to come home on that. I was on the liquid version down my tube, and obviously, yeah. So quick acting, because I can't have slow release, because obviously buprenorphine, babe. Can't have slow release tablets. So all has to be immediate release, like liquids or tablets can be crushed. So it's buprenorphine. You can see, hang on. So this is Butec. Hang on. Butec 15, and then I got a 5 on the back of my shoulder as well. We changed places because of my skin getting sore. I don't like having them both in the same place because they are like too much. They're so big and there's not enough space on my arm. I've had tubes for ages, darling, so you just get used to it. You find out what works best for you personally too. Bless you, darling, I'm sorry to hear that. It's okay, darling. Yeah, I'm a perfectionist as well though, so that's part of the problem. Problem, literally. Hate being a perfectionist, honestly, I do. Because if it goes wrong, yes, it is lovely. If it goes wrong, I will literally take it off and do it again. They do, lovely, but I use a steroid spray underneath. I get prescribed just Tegaderm tape, which is clear, which is the one underneath, but not these, darling. These don't get prescribed. But they prescribe what is these. Hang on, I'll show you. These ones. But they don't prescribe pretty ones. You have to buy these, lovely. Because these aren't like on the NHS, you know, they just don't. But I don't mind buying nice ones. But I do get prescribed the stuff for my skin, so the Cavalon and the adhesive remover. So the adhesive remover to wipe over to take the old tape off, and the Cavalon to put on before I put the new tape on to barrier my skin, which is good. Yeah. And I also get a peel spray as well. Actually, because I use stat locks, so for my catheter. So yeah, my NG tube, it doesn't. So my NG tube, this one, is on full-time drainage, so it's not pH tested apart from when it's changed. And my NJ, you don't do a pH test because you don't check an NJ for a pH because it's not in the stomach. So one is an NG, one is an NJ, one UPH when you put it in, but it's on free drainage, so I don't need to pH at any other time unless it moves. Because it's draining, I know it's in the stomach if it's draining, and especially if it drains what I've just drunk, for instance. So it's got a bag attached to it 24/7. So this is 24/7 drainage tube for me personally. Like some people obviously feed through an NG, I personally can't, my stomach doesn't work. So if I drink this and it drains, I obviously know that's in my stomach. I mean, it's draining, so that's good. Yeah. Oh, it was horrible, darling. The other day. But that was because we were completely public, my sweet. Oh, we're very bile-y today. Very yellow. This is a lot nicer, darling, it is. I don't mind answering questions for people, but it's how they ask, but also, you know, just how they act to people. You know, and what they ask as well. How do I keep going? Have to keep going, darling. There's not much choice, really. So I literally actually just think of the positives that I do and can do, not what I can't do. But honestly, you're not done, darling. It's hard right now, but it's not this hard forever. And I promise you. It might always be hard, but different levels, different battles, different times of hardness, if that makes sense. So not the same intense hardness forever, darling, or the intense struggle you're going through right now forever. Do I get out at all? No, I can't leave my house at the moment, darling, apart from hospital. It does feel nice and positive. Have I read any books recently? No, lovely. I don't read a lot anymore, to be honest. Yeah, I wish I could leave my house. I'm hoping to, but at the moment it's too unsafe with how many seizures I have. And that's just as per my neuro and her team. Where would I go? I'd go to the beach. If health wasn't an issue, I would literally go to the beach and go for a walk on the beachfront. Not on a sandy beachfront though, but near a beachfront where there's like, I know which beach I'm thinking of, I'm not going to say, but where there's like a walkway, if that makes sense. Hopefully, Lorna, darling. Hopefully I'll be on my birthday, yeah. I'm not having more, but I'm not having less at the moment. And I'm getting a lot of infections, so that's the problem. They're helping me to some degree, darling, but yeah, like it's slow process, unfortunately. Hey Scully, I'm alright, darling. My birthday is on Friday. But yeah, I'm alright. It's been a hard day, my love. I've had a seizure, so I'm absolutely exhausted, but just trying to get through. Oh god, that bruise too. Jesus, look at that bruise. It's okay, darling. I have no idea what it's from. Do I have a wish list? No, lovely. I have no idea. Normally, a lot of my bruises are from seizures, but I actually don't really know. It's a lump a bit as well. There's a bit of a lump. That white bit is lumped. You can see that is a lump, like, slightly. You can feel it is, but yeah. Don't know. I bruise so easily though. Hang on one sec. Shite, I forgot to take my anti-epileptic. Fudge. Thank you, darling. Well, one of them. I've taken one of them, haven't taken the other. For God's sake, why do I always do this? It was due at 5. Oh, my lord. Yeah, I always forget it. Oh, well, quite a lot of the time. Yeah, I need to put a new feed up, darling. How many pairs do you mean? I'm not sure, lovely. I don't count them. Oh, I wish something had made me sleep like that. Jeez, that'd be luxury, living the life of luxury, that would. Something to actually help me fall asleep, Christ. That'd be nice. But good night, lovely. It is loads though, yeah, it's that whole drawer set full. Well, all the 3 drawers at the bottom, but yeah. I have 4 drawers, but one's broken. How's my sugars now? I think they're okay, babe. I haven't looked, but yeah. I haven't heard it go off, but actually it's been quite quiet, so I need to check the settings on it. I sleep with all these pillows. Yeah, I actually only have 3 pillows, darling. Yeah, I'm 4.8, so I'm alright. But yeah, I do need to make sure it's going off of its sensors. Alerts. Intense. Okay. It should be loud now. Okay. Oh, bless you. I'm sorry, darling. Sorry, what was I saying? It's about 7. Yes, I have continuous G7 monitor. Yes, I have only about 3 pillows. Yeah, I have one here, and a V pillow. Take care. Good vibes. Hi Amy, how are you? Let's see this. I need to see this. Yeah, my love, there is. And I've got 2 more. Well, 1 more to take at midnight, but the pain not great, lovely, because I fell on the floor last night nearly. Well, I say last night. Was it today? Was it last night? I can't remember. Rihanna, are you there, babe? Was it today? I fell on the floor. I did, darling, yeah, but one of my tubes got pulled. My NG got pulled. In a seizure today, yeah. I couldn't remember, sorry. In a seizure, I nearly fell. Spasms, bladder spasms. Yes, I take medication for. And for... happened before I went in hospital. When was that? I don't remember when that was. Saturday. Tuesday or Wednesday, was it? Oh, I don't know. I can't remember a thing, babe. No, that was for my tube, darling. It was I think Rihanna's on about for a seizure. I only went on Saturday for my tube. The longer one. I can't remember it, babe, at all. This one was really long, but... Oh, what, the admission? The longer admission? Yeah, I was in there for 2 and a bit days, weren't I? The longer time I was in hospital, I get you. Yeah. For my CT scan. My bloody bowels. Literally the bloody bowels. For seizures, but I went in for a seizure that time, but they also suspected a bowel. So basically, after the seizure, I was having drainage that was like, you know, like when you vomit and it's coffee granules, they say. It looks like coffee granules. And it looks, so they think it's blood. It is, darling. But, so they had to do a CT with contrast. Because they were scared I had a bowel perforation. So I had a CT with contrast done as an emergency. On the same night I got taken in, they did it, literally. They booked it in the middle of the night and did it. Because they do a lot more now. They do a lot more at any time. Meconium. What? Yeah, it was scary, lovely. It was scary. But it took longer to... Yeah, Kazzy, that's not right. It took longer to... No, I don't know. It took longer to actually get me cannulated to be able to give me the contrast than it was to yeah. Like, it took me longer to get... It's not Kazzy. So yeah, it took longer to get me cannulated, even with ultrasound scanning. It took longer for the contrast than to be able to actually do the scan, which was crazy, like really crazy. And really annoying. But yeah, Kazzy, it's not, darling. Because they had to obviously get the contrast in me, and they had ultrasound, but it took like... They did one ultrasound, got a cannula in, went to the CT, got the contrast connected, and it ran, but not into my vein, so the cannula had already tissued, even though they'd flushed it with 40 mils beforehand. And they put that one like up here. So then the next one went here. And then that lasted for about 4 hours. But at least we got the contrast in. So yeah. Yeah. Esme is right, Kazzy, darling, unfortunately. So unfortunately, I don't mean unfortunately, but yeah. No, it's not good, babe. We're on my own. I was in hospital, babe, but they... I have a one-to-one with me in hospital, so no, technically not on my own. I had someone with me. Hey, Kaylee. Lots of love, darling. So yeah, so technically I had someone with me, but not like family or whatever. So I was on, not completely on my own, but with like, yeah. No, it's alright, Kazzy, don't worry, lovely. Yeah, that's what I'm thinking. Sorry, I accidentally invited someone. There you go, goodbye. Sorry, I didn't mean to do that, Esme. No, sorry, I didn't mean to send it, babe. I accidentally tried to add you into a box. I didn't mean to, babe. Sorry, I just cancelled it. So that puts you in a box for yourself, so I've just got rid of it, so sorry. I can't remember seeing you this morning, Cass. Sorry, I've literally been asleep all day too, so yeah. Sorry, lovely. Oh, I don't know, I can't remember this morning. I've also had a seizure, so my memory's completely gone, but yeah. I can't remember any of the day, really, apart from Rihanna going on a walk with me. Was the... Oh, okay. I'm not sure, babe. I say going on a walk. She took me on a walk, as in... like virtual walk. She went on a walk and I was on FaceTime, which was lovely. So I got to see outside through my phone, but still it counts. Oh It was really nice of her, bless her heart. She's lovely. She's my bestie. I like colouring, darling. You loved it. Oh, bless you, darling. I think little Pups loved it too, didn't she? Little Miss Puppy. Not Puppy, but Little Miss Doggo. So, not crocheting, but I do colouring, yeah, my sweet. Sometimes, not as much as I used to. TikTok is my main hobby now, only because it's more concentration for me. It's better. It's easier for me to concentrate talking and actively engaging with people than like doing something by myself. And also I like to connect with people. Yeah, I don't like paint by numbers. I like colour by numbers, but not paint by numbers. Rihanna is awesome, bless her. Oh my god, no, darling. I don't show my colouring to anyone, not even a friend. Like, because I'm a perfectionist. If I drew or colour anything, it's my only way to socialise. Exactly that, darling. So actually, yeah, no, I actually don't. Yes, exactly that. Perfectionism. So I won't show it to anyone, not even family, friends, whatever. So I crystal art, diamond art. No, I don't, my love. Hurts my back too much sitting over the table. Like, doing it, like, bent over the table with it, like, yeah, really hurts my back. So, and I've got chronic back pain already, so do you? Yeah, also I dropped the diamonds everywhere. I've had one and dropped nearly 5 of the different colours of diamonds everywhere, which was a nightmare because I can't pick them up. I can't even get on the floor to pick them up, or then I can't get off the floor. Can I crochet? No, darling. I've never been taught. I tried to teach myself, but that didn't go so well. I can crochet one long thin line, so basically a scarf for maybe a very tiny teddy bear. Yeah. Oh gosh. Thank you, it's lovely. You used to teach me crochet. Honestly, I'm not good at picking things up. Yeah, Phoebe, I'm alright, babe, thank you. I knew what you meant, Cassie, darling. Hi, Amy, love. No worries. What looks really difficult, Anna? What do you mean? I am really fatigued, my sweet, yeah. Oh no, it's because it's a really thick, gloopy liquid, that one, babe. And also my hands are hurting. Just really fatigued, my sweet, but I'm okay. But yeah, that white liquid is gloopy. Just really fatigued, babe. I'm fine, yeah. I'm not falling asleep. It's literally because, yeah, unfortunately, the seizure has taken it well and truly out of me. I can't, darling, no. I will not be able to sleep regardless, and I know that. Like, my brain is fully awake. My body is tired. I never actually settle down to get rest. I let my body sleep when it actually falls asleep. Like, when it just conks out, knock out. Literally. It's okay, darling. You're okay, Anna, lovely, I understand. I do it quite a lot, to be honest. I mean, I don't feel too tired to even breathe. No, I definitely make a conscious effort to breathe. Because that's important, very important. But yeah. No, sleeping tablets don't work for me. So actually I don't take any because they just don't do anything. So they will not give me a proper night's rest, regardless. So I don't take them. Good night, Katie. Hope you have a good night. Yeah, no, I get you. No, I've tried like all of the different sleeping tablets available, like from prescription. And like my doctor's tried me on everything because I've always struggled with sleeping, and none of them have ever worked. Fair enough. And even like drowsy medication, I'm on Diaz like 4 times a day, and it just doesn't even help me sleep. It helps, just not with sleep. That's not what I'm on it for, but yeah, I'm awake every night, darling. Like, I get a couple of nights sleep, maybe, in a week, like 1 or 2 full nights, if I'm lucky. But that's because I'm knockout, like, maybe from a week of no sleep, or a few days of no sleep, like 48, 72 hours with nothing. Yeah, I can't see your your comments, Amy, darling. Let me see if I've got filters on. I don't think I have. Nope. Yes, they are, Scully, lovely. Always exhausted after seizures, unfortunately. It has got so long, darling. Oh, sorry. It's actually like, it's longer than this when it's down. It's normally down to here. I don't seem okay. Honestly, I'm fine, darling. It's literally just for the fatigue. fatigue and pain, but I have just taken my pain relief, luckily. So that should help. No worries, Scully, lovely. You're all good. Okay, Rebecca, my love. Let me literally just... Hang on, I need to take my laxative. Or is it actually first? Oh yeah, it's there. That's a support. What do you mean, lovely? Are people here? Because no, I've done them all, babe. I would be able to regardless. It does, lovely. Because I've got quite a few of them. I've got 2 more at midnight. But the midnight ones, if I'm asleep, aren't needed. They're only there to stop seizures at night. Like overnight when I'm awake. So that's why I take 2 tablets at midnight. But obviously they're dissolvable tablets, so they just go in a syringe and dissolve. So yeah. So because I don't sleep at night, they are literally there just to, yeah, prevent rather than treat. They're there to prevent, or try and prevent. It's a new thing I'm trialing with my epilepsy consultant. They have been. I've had 2 nights with no seizures during the night, and normally my seizures are more at night. So I've had 2 nights with nothing, which is good. And I've been taking them on time, roughly, which is good too. So yeah. So I've been taking them at midnight and had 2 nights with no seizures. Yeah, I can see your comments now, Amy, darling. Well, them 2 anyway. It is lovely. And all it is 2 milligrams of lorazepam, which is a rescue for me, but it's being used as a preventative. So yeah, it's good. Really, really good. It's helping. I'd rather it not get to the stage where I'm seizing and need a rescue. Like if I'm able to take something that stays in my system and actually prevents it, or like kind of wardens it off, brilliant. Do you get what I mean? Laxative and then I'm done. Thank you. No, darling, I don't get any side effects actually. Just a dry mouth, a really dry mouth, but that's it. I can take them. So in the day, they're as a rescue, lovely. They're only used as a rescue, but yeah. No, Amy, unfortunately not. It's pretty much permanent, they think. Hi Emily, how are you? I say they think because I'm literally just waiting for 1 more test on my legs, but yeah. How long? About 5 years, but paralysed for 4. Nearly 4, roughly. Happened in 2022, in about June time, I believe. May or June. And I got discharged in December 2022. Thank you, lovely. So I was in hospital that whole time. Yeah. I know personally, and obviously my professionals know, But actually, I'd rather not go too much into it. All I will say is I went into status epilepticus and got put into an induced coma, but got some damage basically to the noggin, the head, head/brain. So yeah, that's what I'm gonna say. But not much, but yeah. But I was put into an induced coma, and it was because of hypoxia. So low oxygen levels, very low oxygen, because of status epilepticus. So a big epileptic seizure. Which is not good, but... And I've been in 6 comas for epileptic seizures. Like status epilepticus. To basically save my life, so ventilator dependent each time, which is terrifying. It was very scary, terrifying, scary, and everything else. But the last one was nearly 4 years ago, which was 2022. So, which I'm very grateful for. That is the last one. But I never know if it's going to happen again, and that is the biggest fear of my life. I did lovely, yes. Not everything though. I just remember hearing some bits and pieces around me, but not absolutely everything, and not all of the time, babe. I don't know. I don't know if it was when they were decreasing sedation. I'm not entirely sure, because obviously I don't know what they were doing around me. Yeah. So obviously I have no idea what they were actually doing, but yeah, exactly. So I could hear some people talking around me some of the time, but it's not like I knew what was going on, if that makes sense. I didn't know what was going on. So obviously, I think it's as they start to wean the sedation down. Yeah. Yeah, so to start with, they weren't weaning the sedation. Not a few times a day to start with, babe. But they were weaning sedation after they'd stabilised me. They started weaning it. So after about, I know I was in that coma for about 3 weeks or 4 weeks or something like that. My longest one was 6 weeks, and my shortest one was 24, 48 hours sort of thing. But I've had six or 7 of them. I believe it's 6. So that one I think was 2 or 3 weeks. I'm not sure, not entirely sure, but I know for the first week they didn't take anything. They didn't taper anything down or wean anything down because of my brain, but also they needed to stabilize other levels basically, because I had a lot of potassium issues and stuff in there. I only know that because of notes, but anyway. And also, I know as soon as they started weaning down to start with, apparently I kept going back into seizures, and I also got, tried to escape. I don't know how I tried to, but it's on my notes that at one point I tried to escape in a seizure. Not in a seizure, but after coming out of a coma I tried to escape. Before the paralysis one, which was the last one. So not necessarily muffled. I don't know, I can't fully remember it that much. Status epilepticus, babe. So because of my epilepsy, to save the brain because of hypoxia. So this is it's happened 6 times in my life. I believe it's 6 times. We've got 4 times definitely on record, but I haven't got all of my records, so yeah, but we think it is 6 times. Between me and my family, we're pretty sure it's 6 times. Yeah. So obviously ventilator dependent each time, but yeah, scary. Very scary. The worst part is waking up. So, status epilepticus is when a seizure has gone on too long. Basically, your oxygen drops too low, the seizure has been too long, and your body just can't cope. So everything starts shutting down and it puts the brain into a big kind of danger where your oxygen's dropping, you're at risk of severe brain damage, so they put you into a seizure, into a coma to save the brain from damage / you not being here anymore. And obviously you need the airway, because airways start closing and restricting during seizures too, especially when they're obviously epileptic. So airways start closing up, you can't breathe, you can't get the oxygen in, they need to get stuff, they need to do something. So it's to save your brain, but also to get you the oxygen in you to then give to your brain, because the oxygen needs brain to keep functioning. The brain needs oxygen to keep functioning. Jesus, I'm tired, sorry. Does it feel like you've been asleep for a long time? I can't really remember, darling. All I know, I think it literally felt like I'd just woken up from a really long sleep, yeah, but I can't fully remember. Like I say, it was nearly 4 years ago. The last one was 2022. I'm very grateful that's the last one. But obviously I always have the fear that it's going to happen again. I always feel very nauseous after a seizure. Yeah. So when I go into the hospital and I've had a seizure, they always give me my anti-sickness through like either IM or IV or whatever form I can have it in, or subcut injection, whichever. And basically every day, darling. But I feel nauseous pretty much all the time anyway, Kazzy, because of my gastrointestinal condition. Sorry guys, can we stop with quite so many questions, because I'm so tired. I will stay on for a bit longer, but I am just knackered. So can we stop with so many quite big questions, because it's wearing me out a bit. Sorry, I don't want to be rude, but this isn't a question and answer session, and I'm just getting a bit, yeah. I'm drained. I'm very drained today. So I'm sorry guys. And also talking about seizures and epilepsy is quite hard, considering obviously it's my life and what I go through. It's difficult in itself. Thank you, lovely. Yeah, I'm on medication, sweetheart, but I have 2 different types. So that's the problem. One can be medicated, one can't. And I will have them for the rest of my life. Which, yeah, obviously, because the type of epilepsy I have is kind of can be treatment resistant and is more likely gonna be treatment resistant, medication resistant. And I've tried a lot of anti-epileptics already, 3 or 4 different ones. So no, mine's bilateral temporal lobe. Bilateral temporal lobe, so it's on both sides of my brain in the temporal lobe. That's where the seizure activity comes from. And that is normally like quite normally treatment resistant, medication resistant a lot of the time, and normally they call it refractory epilepsy once it's over 3 or more anti-epileptics that you've tried in combination, like 3 or more, 4 or more, like with different combinations, and they haven't worked. And I have tried about that many focal. Yeah, I don't have as many focals. I noticed having more focals since my carbamazepine was reduced, so they had to increase it again. But mine's on the temporal lobe, so I get focals less frequently because of the carbamazepine, myoclonics, tonic-clonics, and absences. But I get partial awareness and impartial awareness focal seizures too, so yeah. I think that's what they're called. I get confused about that bit, the partial awareness ones, because yeah, that bit confuses me because that's a new bit that I heard about that I didn't even know I was experiencing until they reduced the medication that helps them, which we did. So we never knew I had them because the medication was basically helping them. I'm on it, darling, yes, but that's for my nerve pain. So I'm on that, but for nerve pain, not my seizures. And actually, sometimes they say it can make seizures worse. Sometimes they say it can make them better. My main medication for my seizures is Keppra, diazepam, and carbamazepine. But long term, they want to take me off the carbamazepine because it's actually detrimental for the liver and the GI tract. And I have issues with both of them already, so we don't want much more issues, you know. We don't want to be creating more issues than it's worth. Oh babe, it could be worse. I will always say it could be worse. I think to myself sometimes, could it actually be? But I will always say it just could be. I have to state, you know, I have to hold that to myself that it could be worse. No, darling. It's not an option for me at the moment. And they actually don't think it would work anyway. And you're on about the vagus nerve stimulator, aren't you? Because of my gastroparesis as well. That could also help gastroparesis, but it's a bit complex, babe. Surgeries are hard for me. Surgeries are hard for anyone with epilepsy and other seizures as well. But yeah. So I've been inoperable for years now. I'm having a tooth surgery, but with GA it's complicated, so I'm having that, yeah. I'm having the tooth surgery, which is under GA, and then they're gonna be seeing how I react first, and then maybe other decisions will come from that, depending on how I react to the GA from that. That gives a tiny glimpse into how my body is gonna react if I have GA and a small procedure surgery type thing. Even though it's not really a surgery, it's just, you know, a procedure with GA, but you know what I mean, like, regardless. But I'm waiting for the date for that. It's been referred, but no date as of yet. 3,600 GABA, oh my god. That's a lot, lovely. Because of my seizures, lovely. So it's a catch-22. I have to be under GA, because if I have a seizure on the table while they're trying to cut the tooth out, so basically no dentist will touch me to take the tooth out unless I'm asleep. And sedation doesn't work because of my Ehlers-Danlos syndrome. Like local doesn't. so the lidocaine injections won't work, so I'll feel everything, but also if I have a seizure because of stress or whatever on the table when they're extracting the tooth. I'm actually not sure, babe. But you can have reactions after the GA that causes seizures. So GA is quite risky with epilepsy. But anyway, yeah. I'm nervous for it too, to be honest, darling. And mine's a broken tooth. It's broken and rotten and it's overcrowded, so it's behind others. So it's all chipped away and the nerve ending is currently completely exposed. So it's not nice right now. And I'm just trying to ignore it. But it sends pains all up here constantly at the moment. It's not great. Yeah, I've got used to it. But I've got a whole, like, but, so, like, it's like half a tooth there, not the whole one. Yeah, so the dentist has referred me to the hospital to get it done. I literally am just waiting for the date for it, basically. No, it's actually just an overcrowded tooth, which is common with EDS. I've got too many teeth. My mouth is not big enough for all the teeth I have, which sounds really weird, but no, it's just one that so you can see my teeth grow at weird angles because my jaw is not big enough. Yeah, my jaw's not big enough, babe, exactly that. No, so babe, this is what I'm saying. Lidocaine doesn't work with a lot of people with EDS, so Ehlers-Danlos syndrome. So lidocaine is not an option for me. It literally does nothing, and I mean nothing. Even the injections, like, yeah, no. For some people it does, for some people it doesn't. People with EDS metabolize medication differently, especially with hypermobile EDS. I don't know the complete science behind it. I just know personally it actually doesn't work for me. That's the only reason I really know. And then researched why does it not work, and then found out there's a link with it with EDS. And because I've got EDS, like, it makes more sense. Let me put my antibiotics back in the fridge, 1 second. I'm going to get out of bed for a minute to go put the antibiotics in the fridge. And get these out, hopefully. Yes, they can come out. It is, isn't it? And autism correlates with it too. Autism correlates with either HSD, which is hypermobility spectrum disorder, or hypermobile Ehlers-Danlos syndrome, which is crazy. A lot of autistic people also have hypermobility of some form. And also have other conditions, like have either non-epileptic or epileptic seizures, which is crazy. So crazy to me. There's correlations between a lot of it. And this is what one of my my epilepsy neurologist is actually studying. She's studying the link between all of them right now. How would you know? Do we? What do you mean, how would you know? There's a Baton scale, lovely, that shows the hypermobile kind of things. But yeah. So the Baton scale shows where the joints that are hypermobile. So the Baton scale shows kind of the hypermobility, but to get a diagnosis of HSD or hypermobile Ehlers-Danlos, you have to see rheumatology. They're the ones that diagnose it. Because with Ehlers-Danlos, it's not, you could have a different type which is genetic, not just hypermobile. There's so many different types of it. But with just hypermobility, it's the Baton scale. It's okay, lovely, but yeah, because I need to get out of bed, just give me a sec, guys. Yeah, I'm getting a bit like too much now. I do need to get this in the fridge before I forget. Do you, lovely? Yeah. There's more people have it than we realise actually, most of the time. Because unless it impacts your day-to-day life, people don't talk about it as much. Which obviously a lot of us it does, they're on here, but the people that don't talk about it, it just doesn't affect as much, you know. Or maybe they're too shy to talk about it. It is, darling. It is. And also the stigma behind it, because they say, oh, everyone has it. You know, that sort of thing. There's more and more people talking about having it. And then it's like, now people are too scared to say they have it almost, because they feel they're getting judged. Almost like, oh, everyone has that now. Do you get what I mean? Which is what so many people claim to have it, but might not actually have the diagnosis, which I hate. Hate when people do that. Like, fair enough, like self-diagnosis is valid to a point. If you think you have something and it's being looked into and it's already suspected by a professional, then yes. But if you are just looking it up and think you have it, but it's not being investigated, then personally I don't agree that that is like applicable to you. Does that make sense? Although if you're trying to get it looked into, then that's a bit different, because doctors aren't the easiest people to get to listen, so it's hard. I can drink, lovely, yeah, not eat though. I used to be able to eat but drain, but now I drink and it drains. So that is my squash and my Monster together. My squash is pink. Is it? Oh, I finished the bottle of squash. This is the purple squash, but I had a pink one before this. My mouth gets so dry. It is, darling, yeah, exactly. But no, so my drinks that I drink drain out, lovely. That's the only reason I'm allowed to drink. Thank you, love. So I didn't actually mean to show my bag. I forgot it didn't have a cover on it. Because I'm putting a cover on it when I'm tidying stuff up, but I forgot. I don't really like showing like the gruesomeness of it, so I'm sorry about that. I'm now putting this on. No one needs to see all that. Being autistic, it's really hard to get doctors to listen as well. Really hard. My parents advocate for me. I physically do not advocate for myself. Like, I hate it. I wish I could just speak up for myself and make myself be heard. But you know what I mean, like people just don't. Like people don't pay attention because, yeah, or doctors don't. Yes, exactly. I'm bad at explaining things and I know that, but I also know that half the time they aren't listening as well. So it's a bit of both probably, darling, to be honest. From my own experience, I can say that anyway. Yeah. Yeah, my mum, my dad, or anyone in my family speaks pretty much for me instead of me speaking, which is terrible, but anyway. Yes, exactly, lovely. Although they are rolling out the new women's health, like, money into women's health, aren't they? The new NHS person on the local, on the political thing. political party, they are fighting to put more, they're fighting to put more money into women's health and get less women dismissed. I saw that on the news, on my news feed on my phone. I'll try and find it later and read it and then talk about it a bit. Yes, exactly. Yeah, Jess's rule or Jess's law or something like that. So if you go to the doctor for the same symptom 3 times, you can then say to your doctor, if they're not actively doing anything, you can say to them, I've said this symptom, I'm experiencing this, it's affecting my day-to-day life. Please, like I've said this 3 times, Jess's rule now applies. Please give me a second opinion, or I would like a re-evaluation. Basically, I would like you to re-evaluate your opinion or get a second opinion from a different doctor. And you have every right to do that now, because that is a law that has been put into place after, sadly, someone passed by falling through the net of the NHS from GPs ignoring her. So in every GP surgery, that is in practice, or should be. And if it's not, then they're not good enough, because it has to be. Yeah, I'll try find it scary and lovely. I'll see if I can. So yeah, like the same symptom, bringing up the same kind of issues 3 times or more. So like if you bring it up to the 3rd time, you can then say, this is the 3rd time, you know, that I'm bringing this up. So now I would like you to re-evaluate your decision, basically, is what you say. It is very, very sad that someone had to pass, and actually she had the big C as well, which breaks my heart. So I've lost my sister to that, and she actually was one of these people that got ignored at the beginning too, with the big C. But she was 7, which is harder, because she was 7. Why would she be like saying anything that if it wasn't true? Do you get what I mean? Why would she be? She didn't even understand it. She was poorly. She didn't understand what was going on. She just didn't feel well, like, at 7 years old, when she actually got it, like the first symptoms and issues diagnosed. Yeah, she was my eldest sister. I still have my other older sister. Yeah, bless you, darling. Yeah, see, I've had that before, my love. I've had a scare of the C, and now I'm having another one, so I've got to have a mole checked out at some point, which is scaring me. But all I can say, Beth, no news is good news, because you know what? If they have the 6-week pathway for the big C, the 6-week pathway should have been put into place. So it should be no longer than 6 weeks between testing and diagnosis. It should be a 6-week pathway in most hospitals / centres now for that sort of testing. Unless they had to send something off and it's taken a long time. Because I had a scare in like 2024 for like chest area, and they literally referred me and I got seen within a week or 2, which was crazy. I didn't even know that would happen. Are they not? So they're testing for it. So, not being nasty, is it in your family? Because they can't be. Thank you. They can't be too concerned if they're just testing, but haven't been, because it's a 6-week. Maybe talk to them about it, babe. Phone up and talk to them, because 2 weeks now, is it? 2 weeks from investigation. It's a 6-week pathway, but like in general, like with the investigation, from identifying the problem to then investigation and then getting the results. Oh, okay. So mine wasn't for chest, it was just, well, it was for chest, but it was just, they just said 6-week C pathway, basically. Which is what it was, but that was 2024, so I don't know. Maybe, darling. See if that's going to need it. For friendly. Sorry, I think we should probably move off this subject because I don't know how helpful it is for others. I don't mind, but I don't want to be triggering anyone else. So I think we should probably move off for everyone's best interests. Of this subject, that is. It's quite scary in general, isn't it? Let's face it. Scrunchy. Oh, thank you. I couldn't even remember which one it was, babe. Good night, Ems. Hope you have a good night. One second. Let's take these out. Hi Lucy, how are you? Are you guys with me, I suppose? Come in the kitchen. Got my dog picture. That is actually a painting of my old dog, lovely. So it's pastel art of my old dog that I had. So it's a spitting image of her. She was called Daisy. So my next door neighbour did it for me as like a memorial piece for when she passed. In pastel, like chalk pastels. Pastel pencils, sorry. Pastels, yeah. No, lovely, I wouldn't be able to look after one now. I live on loan, so it's really good. I'll show you a picture of her in a minute and you'll see how absolute spot on it is. No, darling, I wouldn't be able to. It'd have to be a house cat and a litter tray, and the ammonia would be too dangerous. I wish I was too. It'd be bad for my chest, unfortunately, sweet. They are. And it would have to be a house cat, like I say. And the ammonia, etc. It wouldn't be safe or good for me. Even if the safety was alright, it just wouldn't be good. It's a whole commitment, and I would have no one to look after them, etc. if I was in hospital. So yeah, obviously I'm in hospital quite a lot, so I wouldn't want to put that on anyone else. I wish I could have one though. It's not the stink, darling. It's literally every time you empty that litter tray, there's ammonia in their urine, so it affects your chest, and I'm immunocompromised already. So it's not the smell, it's the ammonia that actually gets into you, that you breathe in. It's not actually like a stink, it's the fact that the ammonia is there and can cause chest infections, etc. And I get a lot of infections and shit already, so. And also I wouldn't be able to look after them completely anyway. And it would all have to go through my landlord, which is council. So I don't know if they'd even agree it, but I don't know. Have you? You changed the litter, babe. So no, that's not technically. I don't know what you're saying there. I wouldn't be able to have an outdoors cat because of the cats around this area, sweet. It would be a bit too dangerous, I believe. I think so, because there's a tomcat around and I would only get a female. I'm getting overnight care, sweetheart, or I should be anyway. It's being taken to panel for CHC funding for it. Exactly, yeah. So yeah, I'm scared. That's why I don't sleep at night, my love. I have 3 carers a day visits, and then mum and dad as well, and my care line, which links to, hang on, this box, which they talk through and ask if I'm responding, like shout, like kind of call my name out if I respond. Obviously they ask what I need. If I don't respond, they know it's a seizure and they call the appropriate people, which is my parents and emergency services. So yeah. Oh jeez, she did a wheelie over that. Where did I put the other tray? I don't even know. I swear I left it somewhere. What the hell? Sorry guys, one sec. I'm just trying to find this bloody tray. Don't know what I did with it. Oh, I left it in here, for God's sake. Why? I need it. I didn't. I don't understand. How have I done with that? Take that out instead. So, oh, I put it under here, didn't I? Bet I did. Yeah, there we go. Here's the tray, under everything. Room tour, there's not much to show you, babe. I had my ears pierced years ago, darling, but no, not. Don't ever wear earrings because, no, physically I react to every type of earring. And it's only like the earlobe, the normal piercing, and one of them, like one piercing in each ear. That is literally it. But I'm done as 10 years old, and every time I put earrings in, they got infected, any type of them. A room tour, what do you mean by that, darling? Because I don't really need to. Hey, Nate, are you okay? And it's also messy at the moment. So you can kind of see the holes, but they've, like, you can't really anymore, actually. There you go, look. We'll be able to get one back in now. Just a bit nosy. Oh well, since you've been nosy, I'll show you this bloody cupboard full of shite. Well, I hate it, but this is literally, look at this. Right, so Febreze first of all, bum cream, ibuprofen, pens. Most of this is prescription, apart from the ibuprofen, like alcohol gels from prescription. A peel adhesive remover spray. A peel adhesive remover wipes. Hang on, let me turn the light on. Cavalon, Sani cloths for wiping the tables down. And then literally wet wipes, dry wipes, catheters, med spots, Let's get some more of these out actually. It is done. I keep everything organised. So I've got my feed bags, dairy feed bottles, some more giving sets that I've got spare at the moment, and the white ports as well. It is darling, yeah, but it's got everything I need in here. Oh yeah, I've got my urinalysis like things as well. So my urinalysis sticks. I've literally got my syringes for IVs and my drainage bags, covers. I've literally got, hang on, gloves and catheter bags. So yeah, there we go. That is your tour, and I've got books and hoodies up the top, and just, yeah. It's a nightmare this cupboard. Hate it, absolutely hate it. And then I've got another cupboard which has all my feed in it. So many of these, yeah, I've got, you don't want to know how many I have. Like, I literally have a whole another cupboard full of hoodies and blankets. Syringes for IVs, yeah, 10ml syringes for IVs. Because to give like meds through IVs, and I've got flushes as well. I don't have IVs at the moment, babe, but, well, if I have an IV then line in, then I do, but they can't gain access. Let me literally show you this cupboard. I don't know how it is, actually. I don't know how messy it is. Because my carers sort this cupboard. Yeah, okay, it's tidy, so I can show you. Hang on. So that's blankets. That's towels and bedding. And that's more blankets and hoodies. And a duvet somewhere at the back there. And the Medi-Fleece is what the Medi-Fleece is, and a hospital blanket. So the Medi-Fleece is from the transport company, and that's just a random hospital blanket I keep. So if I'm going to be sick, then I'm sick on that. It's like B&M. To be honest, I'm going to get another blanket out because it's been a bit chilly. I'm going to get my teddy bear one out. I can't reach it though. Can I? Oh, I can if I pull that first. Oh, don't make me make a mess. My carers will kill me. God, I've got so many I didn't realise. There we go. Shit. Teddy bear blanket. I'm just going to shake it out because that scared me then. I think it was static, but just checking. Just static, thank fuck. Jeez. Excuse my French, sorry guys. I'm scared, I don't like bugs. No, exactly, that's what I checked. Because I'm doing my syringes, I might, which my carers do for me normally obviously, but I might actually make myself a chai latte as well. Put them out and put the box in recycling. I only have 3. Just push the box down. Loads of times, babe, I can't get rid of them half the time because I'm fully wheelchair bound, like, and I can't move my legs to like stamp on them or anything. So my carers always do, babe. No worries. There's a cat pic. Oh yeah, that's just one I got for Christmas. So I've got 2 sterilisers together. It does smell fresh, yes. That's my my travel wheelchair because I can't travel in this one because it's lightweight. Did my blood sugars just go off? I think they did. On my other phone, that is, because that's what my blood sugars are connected to. I heard something ping, so damn it. Okay, I need to fill this can up. It's empty anyway, let's just get a jug and fill it. Or a few times over. How many mils is this jug? 500, that'll do. I literally push myself along the sides and I'm dripping water everywhere. I'm going to leave you guys there for a minute because it's hard holding you guys at the same time as carrying a jug of water. I just dripped it everywhere, and that's a bit awkward really. See there? The broom has fallen over, well. Literally. Hold, please. Got hair in it, no thanks. One bedroom, darling, but yeah. Jug and a cup full, because I can't be bothered to go back and forth too many times. Like, I'm tired. One bedroom, but we've like made it 2 bedrooms by using the living room as a second one. It's only 3 rooms, babe. Like 3 rooms in the whole place. So it's here, there, and there. But then I've got a wet room as well. We'll fill that up. I'll put them in there now. And get another cup out and that cup as well. Water everywhere. Evening, lovely. Turn the plug on might help. My carers have to turn all my plug sockets off as they leave for fire safety. So I need to remember to turn it back off, otherwise one of them will get in trouble. And it'll be me. Itchy for some reason. Evening, Lou, how are you? Not too bad, Becca, thank you. How's your day been? Don't need to. Hi Lily, how are you? Alright, love, yeah. Oh, a chai latte, that's it, darling. Not coffee sweet. I don't normally drink hot drinks. Chai latte is not coffee, is it? Pretty sure it's not. Hi Tara, how are you? Doesn't taste like coffee if it is anyway, because I can't drink coffee, babe. No, it's tea, yeah, that's what I thought. I've got these ones. I actually didn't mean to unblock you, to be quite honest. But yeah, like, you follow some suspicious accounts, my love, is all I'm going to say. Goodbye. Sounds awkward. That was awkward. Jeez. Early night. Is it early? 11 o'clock? It depends which one you're on, which diagnosis, lovely. Because every process is different. Like, for every disorder / diagnosis is different. Fair enough, yeah, I don't. It's early for me too, but not for the average person, you know what I mean? You think you do, or your doctor does? Because you have to go for tests, darling, like tilt table tests, to actually get a confirmed diagnosis. So autonomic testing of the autonomic nervous system. So a tilt table test, but you need to see cardiology to rule out other things first. So cardiology or an actual autonomic specialist. Depends on your area. Personally, for me, I'm under an autonomic specialist. No, I get you. But yeah, you need it investigating before, like, obviously having it, like, or saying you have it, really. Some people say they have it when, you know, they're being investigated, but, like, the professionals are pretty sure. But yeah, I don't. This is only my own personal opinion. I don't agree with self-diagnosis. But yeah. But I understand if you do think you have it and you fit the symptoms, then get it checked out. It can be really debilitating, depending on the severity. No, that's what I mean, darling. But I mean if it's highly suspected. because I don't know obviously where you are. No, I know you're not. I'm not saying you, darling. I'm just saying in general. A lot of people do it, but yeah. See, Neuro saw me for mine. So Neuro saw me for my POTS, but that's because I'm under a neurology hospital. And actually, they have an autonomic testing unit there. So they have an autonomic ward there, really. Autonomic testing unit, autonomic testing unit, which is where I'm going. I'm going back there to have another tilt table, but they've already reconfirmed the diagnosis because I already had it anyway. But we know I have it. What? So I've got to have another tilt table, but because I've had one before, I've already been contacted about this one. So I do have it, but they want to see if it's got any worse or better with my medication I'm on for it. I've been contacted by the service manager. No, lovely. I can drink, just not eat. I actually haven't had that, surprisingly. Not anxiety, anyway. But I've never presented anxious in any way, to be honest, which is weird. But then, yeah. Although, even though, like, I had a letter the other day from from one of my specialists, and it says anxiety on my diagnosis list. I've never been diagnosed with anxiety, so it's really weird. Oh, see, mine doesn't come with chest pains, it's palpitations. But the palpitations are really severe, and I'm also a fainter before I was in a wheelchair. So, yeah, that's obviously slightly different. But I'm so sorry you're going through that. It's hard when doctors are dismissive. Gastro doctors and cardiologists are the worst for dismissing, apparently. Apparently, obviously, I'm not entirely sure. Because I didn't see cardio. So, yeah. I'm alright as I can be, love. Evening, lovely. Hope you're okay too, my sweet. Yeah, fair enough. Their first line they normally go to is like propanolol, but I don't. I can drink anything, darling, because it all drains out into this bag. So through this tube, hang on. Through this tube, it drains into a bag that is in a cover right now, because obviously I don't want to show it all off. Because I did that, and yeah. So my blood sugar is really low. Jesus, no. So my blood sugars are really low. Fuck. Have a good day. You too, lovely, although it's night time here. What the bruises from seizures mostly, unfortunately. Try an apple pie one. I'm not sure what they are yet because I've just heard it go off. I don't know. Fair enough. Yeah, they normally. Have you ever had? No, I haven't. This is apple pie chai. I know it did, that's why I said it like that, lovely. Love rhyming. Well, I'm not sure, lovely, to be honest. I'll probably be the one beginning with S or T, which I think it's the T one, which is TEMU. That one, probably. Yeah. This is why I use trays. It doesn't let you say any shop name at the moment, darling. I just have, darling, yeah, I've just switched it off. You know, thank you. Need to check my blood sugars. Where is that phone? I'm not sure. My blood sugar phone. I still need to do my Coloplast charter order for my catheter supplies. The ones that I actually need. Nightmare. Yeah, stitch calendar, babe. Lilo and. I got it for Christmas. How many of these have got around the other side? I need another one out? No, I've got plenty there. Try not to put things on the floor. Shite. Oh, my reed diffuser, damn it. Quick reflexes that was. I don't have it. I can't fold them because they're too heavy. Oh, Lord. There we go. Stay. It's not neat, but my Karen will sort you out. My little gingerbread man's fallen on the floor. Well, there's no liquid in the reed diffuser anyway now. Ems, how are you? Baby Gingy, what? What about lovely baby? Oh yeah, literally. Oh sorry, I got well confused then. Yeah, he fell off the windowsill. That's not good, is it? He got a bit drunk with the diffuser liquid. Jokes. Liquid, not liquid, glucose just in case. Jeez. Oh, my brain fried. Let me just get my banana board. So cold. Hello guys, I'm here. Yeah, now I can get my bed coat. Yeah, I do need to check them. Sorry, thank you for reminding me, babe, actually. Okay, it's not that one, that's the old one. In here, when it. Yes, here it is. So it made a noise for sure, and it won't be high, so once a week, darling. Okay, we're okay actually. Or something else, was it? No. Hang on one sec. Yeah, it's that phone, it's not this one. Yeah, so it's at 4.0, so yeah. It was 4.4 and then went down to 4.0, so that's why. So it's going down, that's what it's telling me. So any lower and I will have to treat because I dropped like a brick like really quickly. And one of the notifications was TikTok as well, so. Oh well. Yeah, the alarm was the desk Dexcom. But this phone, obviously I'm on, it wasn't this one because I was actively on it and it was coming through from, I get them mostly from TikTok shop actually. I get them from anywhere, but I bought I bought 2 this time and they sent 4. And they didn't want them back, so I did say I can send them back, but they didn't. They said there's no point because I'd already sent them out. So I got 2 free ones. No, literally. It's because I have two beds. That's why I have one on each bed, so I can go and lounge in the other room too. Which is really nice. It's nice to have a change of scenery. And I gave one to my sister as well. And I also have one ready to go with me to hospital, just in case, because they never have a pillow, so that's my 4. So it's quite good they gave me 4 actually. But I don't know if I actually accidentally bought a pack of 4 instead of 2. I might not have. Who knows? I thought I'd click 2, but maybe I didn't. I cannot remember, and it says 2 on the thing, but well, I'm not sad about it, to be honest. Not begrudging. We don't have any pillows in our hospital, and if you're in A&E, you don't get a pillow because they prioritise the patients in the wards. So A&E rarely give you a pillow. You might get a folded up or rolled up blanket if you're lucky. Yeah. And obviously their blankets aren't very thick either, so rolling it up in a pillow. Yeah. So I take my own normally with me. Well, the ambulance crew literally take me in with my own sheet and my own pillow because they slide me on my own sheet. Onto their stretcher, so it works better. Thank you, darling. That one and that one, yeah, they are both really useful. And this is a TV unit, which is really useful too. It's an old TV unit that was left in this bungalow, so it got scrubbed down. It was left when I moved in. It's the only bit of furniture that was in here from when the old... I can't feel it, darling, under me because I'm paralysed from the waist down. But yeah, it's a pressure mattress, darling. It's a hospital bed with a community profile bed, which is like a hospital bed in the community, but with a pressure mattress. It's got a pressure pump on it. But I don't really know. It's hard to tell. Some people say they're comfy, some people say they're really not. They're louder, which is annoying. I hate the noise of the pump sometimes. So we've kind of muffled it with zebra in the middle. My carers, darling. So I have got pressure sores, but my carers check and have to look 3 times a day. So I'm paralysed from the waist down and incontinent from bowels. So yeah, they check my skin integrity every single day, multiple times. 2 or 3 times, depending on how many visits that day. So that's how I know. Because they tell me. And they apply cream regardless to try and prevent. But I've got the ointment at the moment because it is a pressure sore. But it's around a mole, which is the worrying thing. It's too hot at the moment. Just open the little air vent. I can't drink scalding boiling water, babe. Thank you. Nate, is everything okay, mate? One sec, I want to check someone. I don't put milk in there at all. Some people do. Hey, Kalinda, babe, you okay? Rihanna, are you still here, babe? Are you okay? If you are. Have you gone to bed? I don't know if she's still here or not. Okay, bless you. I'm alright, darling. Don't worry about me. I'll be fine. I'm waiting to start physio soon, which is a daunting thought. No, I'm alright, babe. I had a seizure this afternoon and yesterday afternoon. So, like, I'm drained, absolutely drained. Not tired to sleep, but drained. So, yeah, I'm really in quite a lot of pain at the moment, but it's okay. At the moment, yes. My back, neck and shoulders, babe. They're okay at the moment, my sugars. But yeah, they are going down. Well, they keep going up and then down again. So, yeah, they're going between 4.3 and 4. They haven't gone below 4 yet. But I'm waiting for it because I know it's coming. It's not good, but it's not bad. If it's below 4, I need to treat. So if it gets to 3.9, I need to treat, babe. Because unfortunately they drop like so quickly. So yeah. And they can trigger seizures, which is what I really don't want to happen. Because I really don't want my parents to have to wake up to come out to me. It's not fair on them, you know. I feel bad for them. Every night it nearly is. So yeah. I'm going to actually draw this up ready just in case they do drop suddenly. If not, it will just be ready for the morning anyway, or whenever, so. I'm going to have this ready to have next to me. I'd say a week. It's been more than a week, darling, but yeah. It's all the time, unfortunately, so yeah. Ever since they started, they've got progressively worse, my love, not better, so it's the worse. That's what I'm doing, yeah. I used to only have one once a month sort of thing, seizure-wise, or 2 a month. And now it's sometimes more than once a day. So they want me to have a few days stability in a row, more than like just one as a one-off. So more than a few days without seizures. So like 3 days without seizures, or less intense seizures. So they last less time and don't need, you know, oxygen, etc. So it depends, one or the other, like, or both would be lovely, but yeah. Oh, it's nice. It's still too hot though. My non-epileptic ones can last up to 4 hours, is the longest one I've had. So yeah. But my oxygen still drops with the non-epileptic ones too. Which is the nightmare of it, because it's still dangerous. Yeah. We're waiting for the CHC to get back to us about the funding for everything. And we need an OT because they're going to get a hoist for us, babe. Because obviously I've had a lot of falls recently onto the floor in seizures. They want to get a hoist, a community hoist, so they want to size up, come in my home, get the OT to look at my home, etc. Which they've been out to me before, but it might be a different one. Yeah. But the hoist is almost a definite, because it will prevent needing an ambulance just to get me off the floor, which is good. And also it's better for the ambulance service, because I feel like it's just wasting their time. But also it can't just leave me on the floor all night and all day and all night and all day again. And obviously it's not me calling them either, so, you know, it's not going to be good for pressure sores, you know, not good at all. But yeah, I I hate them coming out, to be honest. I absolutely hate it. I just feel like a burden to them, but they tell us to call them, you know. Am I right here? Yeah, it does. For some reason, my ears do go really red, and sometimes it's when I have a temperature. We'll check it. This is right. They randomly do it. It's weird. I know I'm not wasting their time. That's the reality of it, but it just feels like it when, like, you know, they've literally got lives to save. But then I've had lots of times where they have needed to save my life, and they have saved my life. So yeah, you get what I'm saying. Like, I know it's necessary, but it's that kind of thing of like invalidating your own stuff. Or like gaslighting yourself, essentially. $37.6. One is a lot hotter than the other. One's 37. Oh, it was 37.4. This is 35.6. So 6.4. This is all over the place. What's going on, mate? Hang on. 37. Yeah, that's what I'm doing. $37, 36.9, yeah, so 37. Well, I haven't had it through my life, babe, it's just on here, but yeah. Well, started on here, so like about 2 years ago, roughly. Dry skin peeling off. I hate that. I put my new feet up anyway, sorry. Distracted. No worries, babe. Put it back in. And what's the time? Is it midnight? Nearly time to take them meds. No, they wouldn't, darling. Honestly, they don't affect me, darling. People think they probably get to me, but they really, really don't. I find it quite laughable how, like, just, yeah, how silly they are to waste their life hanging on someone else's life. I just find it silly. Like, they could be out there living their life and they choose to be sitting in front of a screen hating on someone else's life that actually can't be out there living their life right now. So, yeah, you know, whatever. It's laughable. mum to 6. How are you, lovely? Bless you, darling. Sorry to hear that. We're all here if you want to chit chat at all. Hi, Melanie. Hey, Amy, darling. Amy, you're back, my love. Are you okay? My love. I thought you went to sleep, didn't you? Did you go and sleep? Or were you not on here? Okay, what? Oh, what? Was it, your comments weren't coming through, babe? Oh no, I think it was Rihanna that went to sleep. Is Rihanna asleep? Or is she still here? Or is she asleep in here? What's the point? Can't get this open. She's still here, split. Esme's still here too. Esme, are you still here, babe? How are you doing, lovely? I can see Esme in the list, but I don't know if she's actually here or not. But Rihanna's not, no. She must be asleep. You're here, Kalinda, babe. Thank you. Oh, bless you. Shit. Bit. Gross. Sticky. Hate that. They put gloves on for this because I feel like, this is going to be utter catastrophe. You're so tired tonight. Get some rest then, babe. Amy, get some rest, sweetheart, if you're tired. Also, have you taken your vitamins, sweet? Just checking with you. Have you taken your vitamin? Like, you know what I mean? Yeah, you have. Good. Bless you guys. I need to sleep. Am I keeping you all awake by any chance? 'Cause I'm sorry. Well, I'm not that sorry because you're the ones choosing to be here. Did you not hear what I then just said? I'm not that sorry because it's your choice to be here. 8:50 a.m. Oh gosh. Are you still in bed, Kalinda, or have you got up yet? Okay, I'm now going to Amy, yeah. I'm now putting it on, sweet. No, you're okay if you do, lovely. I get some people that just do, and that's fine. I don't mind, my love. Hope you have a good night too, my darling. Night night. Hold on a sec. Easy to just do that. Get all the air out. Hi Taylor, hi Mum to 6, hi Mum is my angel, hey the Shan. How are you? My belly just rumbled, Jesus, that was a funny noise. Where did my belly rumble? That was crazy, mate. What's going on? Hey Holly, hey Elle, Grey Kitten, how are you? Hi T, how are you? Okay, filled. So clear. So it's meant to run for 22 hours. Or, well, 20 to 22 hours, depending which rate I can tolerate. But yeah, at the moment it's not, because I can't tolerate even that much of it. So yeah, bad. No worries, Amy, darling. You get some rest, beautiful. Hope you sleep well, okay? Talk tomorrow, sweet. Rest easy. Yeah. I hate being attached to you, my love. Hi, Rebecca. You're in and out a lot, my love. Is everything okay? So one sec. Checking sugars beforehand if I need to give it them. And I can give my nighttime meds now, my midnight meds now, because it's 2 minutes, to be honest. So, yeah, it makes sense. Well, this is a pain patch, darling. Butec pain patch. So buprenorphine pain patch. No worries, darling. I hope you're okay. I haven't done much, darling, but yeah. Been alright, I guess, thank you. Have you had an alright day, my sweet? Anti-sickness as well beforehand. Yeah, I can't leave my house, sweet, so that's the problem, but it's what it is. It doesn't bother me too much anymore. Low battery. What is this? Hey Helen, how are you? These look exactly the same, but they're very different medications. They literally look the same. I do love I have people, but I'm not allowed to go out right now. I'm housebound for a reason. So it's not my choice, but it's also not because of not having people. That's okay, love. Because I have carers 2 to 3 times a day, so they would take me out if I could. But yeah. Oh well. Morning. I've done a smart pill, capsule endoscopy. So like the capsule endoscopy where you swallow it. Do you get what I mean? And I've done a gastric emptying study. So you swallow the capsule endoscopy thing. Different places call things different things, so I might have done, but I'm not entirely sure. We call it the smart pill, like the little capsule endoscopy, but some places even call that different things, like the camera endoscopy. I'm not going to go into it, lovely. It's part of my care plan right now that I can't because of my seizures, but I don't need to go into it any more than that. So yeah, basically because of safety. Oh, so yeah. No, it's similar, babe. So it gets imaging while it's going down, yeah? Is that what you mean? So, so they can see the images as it's in you, yeah? Is that what you're on about? Thank you. So they can basically see inside of you, and they also, yeah, I get you. But then they also see if it's come out, don't they? Whereas mine didn't come out for like months, which was the problem. I can't remember, it was quite a while, well, it wasn't that long ago. They retrieved it back out because it was still in my stomach. So yeah, they went down and grabbed it back out because it was in me for like, I think like 3 or 4 weeks, something like that. So they went down with an endoscopy and retrieved it because yeah, it was in me for a long time. So yeah, I think that is what I'm talking about, but it might just be called something different in a different hospital, babe. And the x-ray you have will just be to see where it is, if it's moved or if come out, or if it's like, I don't know, like lodged anywhere as well. Yes, exactly, that will be good. I hope you get some answers from it, my lovely. You deserve answers, everyone does. Especially when it comes to health and your own health, you know. Everyone deserves to get the appropriate care that they need. I'm going to come off in a minute because I'm done in. Literally done in. Hope I can sleep. I doubt I will, but I just hope. Yeah, I'm okay. I'm going to come off, and I forgot I keep needing to order my Coloplast. So I'm going to come off and do that, and I'll be back a bit later if I'm not asleep. Okay, guys. I'm going to put my feet on as well. Yeah, I'll see you guys in a bit.